Ramaswamy Govindan, Professor of Medicine, Washington University School of Medicine in St. Louis. So I get asked this excellent question: should we do germline testing for cancer patients? And in fact, we addressed this a couple of years ago. We looked at the Cancer Genome Atlas data set. We had over 10,000 patients for which we have tumor as well as the germline testing, that is the normal tissue testing. It turned out that about 8% of cancer patients across the board had inherited susceptibility gene mutation. And where it is important is, you could then ask the question, are these gene susceptibility or mutations are passed on to the children? Especially, a well-known example is the BRCA mutation for breast cancer patients. And I think it's important to really do genetic counseling for the family and the necessary test in those instances. When we looked at the lung cancer population, again, it turns out that 6 to 8% of lung cancer patients appear to have gene mutation that are probably inherited, or at least present in the germline. It's hard to say inherited. It's present in the germline. Some are inherited, some are not inherited. And the correct way of saying that is about 6 to 8% have some germline gene mutations. Some may be inherited. So some vendors, some commercial labs today test both germline and the tumor tissue. And I always favor that. The reason is that that really gives us additional bit of information, for the price of one, that may be quite relevant for some families. And second, it also improves our detection for some abnormal gene alterations in the tumor cells. When you compare the patient's normal tissue with the patient tumor tissue, you have an excellent comparison. And that's how we have done all the early stage discovery studies in the Cancer Genome Atlas, looking at the patient's normal as well as the tumor tissue. So should we really look at the germline alteration in every patient with lung cancer? The answer is no. If there's a strong family history, it's certainly worth looking into. And so we should really, really look into that. Lung cancer in general is not transmitted in a hereditary fashion among non-smokers. There is some susceptibility for developing lung cancer among smoker families. That is, if mother had smoked and got lung cancer, the daughters are at a little higher risk, especially if they are smokers. So of course, in these instances, we should not forget the importance of smoking cessation and counseling, etc. But the germline alterations are rare, but they do exist in lung cancer patients.